People come to your practice with the understanding that you're going to keep them safe. When you go to this course, you really are keeping people safe. You are living up to that I am doing everything I possibly can to be the best injector, to be the safest injector. We learn things on paper, and we can be taught where anatomical structures are, where vessels are, and we learn things in this really two-dimensional view. When you're able to see it and feel it and dissect it and really understand where they are located, it gives a whole different appreciation, and it just cements what you thought maybe you knew, but now you really know it and you really understand it.
So the first time I did the cadaver lab, I just kind of went in like I was injecting at home, right? And then to do the cut down to see like, wow, that artery's right there, that ligament's right there. That made my angle change, my depth. I really had a 3D look at exactly where I'm placing that product. I felt like I had X-ray vision instantly. So I can see the structures, right? I know where I'm placing it. I know where I want it to go. You're a better injector. Like we can just feel it, the way you're talking, the way you're injecting.
I absolutely would recommend this course to a colleague. I feel so much better about injecting now, and I think that anyone could benefit from this.